And in the care home, some very old people on their last, they're on the way out. There's that sort of, what's the terminology you use when you're on your end of life care? That's the thing. Would they be offered it even, or is it who decides?
They will still be offered it because it is not for end of life care these days.
You're not playing God on this then.
Well, to be fair, Paul, end of life care is very different to where it was maybe even 5-10 years ago. Yeah. So when we talk about end of life care, people can live a lot longer in an end of life care state.
And who makes the decision? I mean, is it themselves, or would it be next of kin that decides on that?
It would depend upon the capacity of the person. So if the person has capacity to give consent,
and what does that mean? Exactly?
So capacity means you have the mental capacity,
and you can sign. Do you have to sign for it?
So that you can actually agree to have the vaccine. As long as you have the mental capacity, then you can consent. If there is someone who does not have mental capacity, then it would depend if they're next of kin or whoever is in control, power of attorney of their estate. They can consent on their behalf.
So this first batch that comes in, will that just deal with the care homes and their people that look after them?
Yes, so that will be dealing with the care homes, but also we will probably take in some of the frontline staff on that as well.
And do you know when the next lot will be delivered? I mean, there's going to be quite a
gap, there's a full rolling delivery programme between now and next
September.
Oh,
you've got all the paperwork, have you?
So we're expecting regular deliveries because obviously we've got to book the doses 21 days after as well, so we need to know what the delivery schedule is.
But of course things can move any second now. You might get another vaccine approved, right? Literally. We're waiting for this news, I'm sure.
Yes, and the same with the Oxford vaccine.
Yeah, so that changes everything again.
It does. I mean, obviously with the Oxford vaccine, again, as I think we referred to it on Thursday's press briefing, that is much more transportable. It's much more movable. It doesn't need to be cooled to the -70, and so the vaccinations we deliver will be a mix.
And will that still be at the hub at all times, or will it eventually percolate down to GPs doing it in their own surgeries?
Well, at the moment we're looking at doing the hub because it's the easiest and most practical way of getting people through. Yeah, just the one hub on the island. We'll be able to move people through. I don't really want to say a production line, but relatively quickly.
Yeah.
And it means also, of course, like I say, with the transport of vaccines, once you've defrosted it, you can only transport it once. So it is, and you've got the 6 hours to deliver the vaccine. So it is important that we centralise things to make sure that we don't end up with vaccines that are wasted.
If all three get approved within the next week or so, do you see us finally getting everyone done by Easter or something? Have you got in that head? Is there a rough sort of idea?
No. We need to be clear on this. The delivery. Don't forget the vaccines have to be produced, then delivered, and through the UK, and then delivered to us. So it is a rolling programme between now and September next year. Now, this is one of the things that was said very clearly by the UK yesterday. Dreadfully eludes me who said it, which scientist said it, but that it's a marathon, it's not a sprint. And we need to be very clear that although vaccines are basically the light at the end of the tunnel, we've still got the tunnel to go through. So it's not going to change things overnight. We need to be aware that this is an ongoing programme. It's the biggest immunisation in human history, the biggest vaccination programme ever undertaken.
If business people who need to travel want to do it, is there a way that they can go private to beat the queues?
Not via us.
It will be possible somewhere?
I don't know. There might be private companies out there that have access to a vaccine supply. I've been obviously focusing on DHSC. From us, it will not be possible to beat the queues. We will be going through a proper public health programme where we'll be immunising via groups.
Don't say I've asked you this already, because I know I have, but you're just updating, because I have to keep asking.
No.
The fact is, eventually, surely people wouldn't need this two-week isolation on the way back if there's definite proof that they've had it, the vaccine, and they've got their piece of paper or on their phone or something. Sure, there must be a way out.
That would still depend upon prevalence rates, because a lot of our decision making, particularly around travel and everything else, will be done on prevalence rates of the virus. Now, if you're rolling out a successful vaccination programme, you would expect the prevalence rates of the virus to naturally go down. But some of the unknowns we don't know about the vaccine yet is, firstly, does it stop people contracting COVID-19? The evidence at the moment is that it doesn't. You can still contract it. But you get less symptoms, so it doesn't make you ill, basically.
But you could pass it on then.
And that is the other unknown. We do not know that if someone vaccinated contracts it, are they then infectious to others?
Okay, it's not a silver bullet then if this happens, is it?
So it's still up in the air.
And when do you need your next one, of course, as well?
Or in fact, how contagious they are. And of course, as you've just said there, we don't know how long the antibodies last either. Although again, the science around that and some of the stuff I saw coming out last week is actually looking very encouraging, because they on the measuring on the studies that have measured the level of antibodies is actually higher than those who've had severe forms of COVID-19. So it's suggesting that the vaccine is actually inducing a higher antibody reaction than the virus does itself, which is a positive.
Obviously, we've still got all these people in the UK who want to come and visit friends and family, and I'm just trying to see, if there's any way that they see some light at the end of the tunnel, that they can get in here under the present circumstances by saying, well, look, I've had the vaccine, let me come in, please.
No, it may be something that would play into the 3A. It wouldn't remove necessarily isolation requirements, but it is something that may play into our decision making around 3A. But we do need to be clear that at the moment, all our decisions around borders are on virus prevalence. But like I say, if you start seeing a successful vaccination programme going across the UK and other countries, then you should naturally see the prevalence of the virus going down.
How close was 3A to get through Council Ministers last Thursday? Because I obviously heard things, and you had that presentation, didn't you, early in the week?
Yeah.
And that was the last chance to do it for Christmas, wasn't it, really?
It was.
How close? I know you discussed it, right? I mean, you did obviously discuss it.
Yeah.
So
your council was pretty much united. It was pretty much united. To be perfectly frank. I think people realise
that it was a bit more split.
It's not gone down far enough in the UK. We were all hopeful. I was hopeful myself that we might be able to give an extra Christmas present and be able to move to the 3A. But at the moment, it just isn't there in the UK, particularly in the northwest. And
again, with a bit of hindsight on this one, TT gets cancelled, and a day later the vaccine's announced almost. That would have been the decision to put off if you had known that vaccine was going to come?
Well, no. Obviously we've been dealing with the UK, so we've known the lines of where things are actually going with the vaccine for quite a long time.
Oh, you're in the inner circle, are you?
We do have conversations with the DHSC and also Public Health.
So you knew it was going to happen
in the UK. So we knew it was pretty close to the line, but that's not going to drive the decision around TT. Like I say, there's going to be vaccination programmes still ongoing in June time, not just here but around the world. And obviously we've got to be very careful that what we don't do is allow a mass event to take place when it is still when prevalence rates might not be as low as we want.
But only 8 weeks later, whatever, the Manx Grand Prix / Classic TT, that's still on. So
for the moment, obviously decisions will have to be made about that in the new year. But at the moment, we're hoping that can go ahead. But it could be a very different world come June. But I think the important thing was the Department for Enterprise needed to make a decision. We needed to make it early. We didn't want to be in a situation like last year, because of course our outbreak didn't really start until end of February, start of March, where we're suddenly making a decision then when everyone's booked, everyone's arranged everything, to say OTT's cancelled. We wanted to make sure that people had enough notice so they could make decisions themselves at that point.
We have one active case, don't we, that's been detected. Is that still the case today?
It is indeed still the one case, as literally as we're speaking.
Yeah. Clearly, we look at places like how Jersey have gone one way and Guernsey, their neighbours, and we went with Guernsey. You must feel that you're vindicated, and I say you, I meant the Council of Ministers, because people don't know, Jersey went and opened their borders particularly. They put economy first. I'm not trying to make this too, but that's basically, there was two ways to go, the Guernsey model of Jersey. Anyway, they've got loads now, and they're literally
500 active cases.
500?
Just over 500 active
Which is pretty scary, and they've now had masks put in and lockdowns and the pubs and that sort of thing. Do you feel vindicated? You must, I suppose, when you see that.
Well, I think we've made tough decisions as we went along, and the tough decisions have worked. It's been on the advice of our medical practitioners, public health, and the clinical leadership group. There's been a balancing act. We've had to do a balancing act just like Jersey and Guernsey have around economy and society, but we seem to have got that balance right, and the island at the moment, touch wood, is in a very good position. But the
economy at the end of the day, and Australia, who's been super cautious, they've opened up Victoria now, flights into Melbourne are coming in, but they've got to do 2 weeks isolation. mandatory isolation. So again, this is back to 3A, isn't it? It's all getting to this next stage. Yeah. You're going to have to do it at some point.
Yeah, we are, and as was said at the as I said at the press conference on Thursday, we will consider it again in January. Like I say, there was some of us who were hoping we could give it as an extra Christmas present, but unfortunately, we hope people all understand at the moment it just isn't practical with where the UK is.
I should add, besides the fact we're still on Zoom, it felt better, that press conference on Thursday. You and clinicians, it seems the natural way to do this thing if you're going to keep going on these things. What do you think? Getting the message across from somebody who is on that side of the fence rather than just the politician, if you don't mind me saying. Having that.
Well, we've had the Director of Public Health there for several weeks now, and also throughout the pandemic, we've had various different clinicians attend. We've had the medical director give presentations. We've had Dr. Khan from microbiology give presentations. So we have had a mix of clinicians there. I think the Director of Public Health's been present at least the last 4, from my memory, to be able to answer queries.
And what's the feeling out there? You feel everything's under control, people are relaxed, being vigilant. We keep talking about this now, about keeping the hand washing going on, that sort of thing.
Yeah, it is important people remain vigilant. I think it is under control. We have that one active case that came from someone who travelled, who is in isolation, and again, it's down to what everyone on Ireland has done that we've got this far.